The FDA now warning people not to use certain types of eye drops because of microbial contamination. The brands in question are Dr. Burns and Light Eyes. Consumers who have Dr. Burns MSM Drops 5% solution and Light Eyes MSM Eye Drops eye repair products should throw them away immediately. And there are concerns in Kentucky after a school district is forced to cancel classes due to multiple illness outbreaks, cases of COVID, the flu, strep throat. They've all been reported in the Lee County School District, and just 9 days after school started, attendance dropped to 81%. The district said it used the days that classes were canceled to sanitize buses and the buildings. Joining us now to talk more about this is Dr. Sean Kumer. He is the Associate Chief Medical Officer for the University of Kansas Health System. Doctor, thank you for being here.
Thanks for having me, Kelly. Absolutely.
So do you think canceling classes and sanitizing is enough here?
I think that's the right first step. That's things we can control. It's not surprising that bringing people together after a long summer away and in close quarters, that infectious reasons come up like this. But I think it's the right move to try to sanitize.
Wonderful. Any other recommendations to help folks there stay healthy?
Well, when you think about things we can control, there are some choices there. When you're talking about COVID, and strep, there are different infections, and the flu, of course. And we have choices to make: vaccines, masking, washing your hands, and staying home when you are sick.
And as classes start across the country, what recommendation do you have to help keep students safe and healthy?
I think it's important that folks wash their hands and stay home when they're sick. Be mindful of not exposing your coworkers or your classmates.
So if you take over-the-counter fish oil supplements, you may want to rethink that. That's according to some new research published in JAMA Cardiology. Scientists found that the supplements do not offer cardiovascular benefits. However, marketers still say they are beneficial to heart health in order to sell these products. So, Doctor, research has found that people who eat seafood regularly are less likely to die of heart disease. However, research has not shown that fish oil supplements offer the same benefit. Why do you think that is?
Yes, I mean, the article talks about N3 or omega-3 fatty acids, and most of that data shows that there's not necessarily a great cardiovascular benefit in diabetics. There may still be a good benefit in other folks in preventing cardiovascular disease.
So if people want those cardiovascular benefits, what do you suggest they do if they're not going to be eating the fish?
Well, I think that there's some data out there saying purified omega-3 fatty acids are better than necessarily some of the things that might be over the counter. So I think that it's when you consult with your physician, it's something that's a personal issue between you and your physician, but there still may be benefit in eating fish and having omega-3 fatty acids that might be purified.
Wonderful. I'd love to get your take on one other health headline we've been following. New research from the Centers for Disease Control found that the recent wildfires in Canada caused asthma-related ER visits to jump a total of 17%. This was in the U.S. The report analyzed the days from April through August when those Canadians smoke that impacted most American cities. Another CDC report studied New York ERs and found that they saw more than 1,300 asthma patients in just the first half of June. So, doctor, what symptoms do people who have asthma get when they're exposed to this dangerous air?
Yes, the air quality index in those areas in the Northeast is considered 50 is considered normal and healthy. When it gets above 100, it gets dangerous. And I think in that area it was more than twice that. So these particulates in air can cause sort of a reactive inflammation in the airways, increasing mucus, causing bronchospasm and inflammation. And that makes it very difficult for oxygen and carbon dioxide to move back and forth. So it's not surprising that this occurred in the area.
What would be your recommendation, and unfortunately we only have about 30 seconds left, to everyone in those impacted areas to stay safe and healthy when that smoke is present in the air?
Yeah, so I think there's two main areas when you talk about asthma. There's a chronic phase and there's also an acute phase. And what you saw with those ER visits was more acute. So it's very important to have maintenance medications for the asthmatic. And those have developed over many years. And in conjunction with your physician, obviously there's a tailored to each individual. And obviously having a rescue inhaler for acute situations like albuterol or Ventolin, something of that nature. But obviously trying to stay in an area where you can avoid some of this is beneficial.
Absolutely. Can understand that. All right. Thank you so much, Dr. Sean Kumer. Really appreciate your time and your insight.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.